in critical condition, including some in very critical condition.
That's correct. There have been 29 patients seen here total. 8 are in critical condition, and many of those are very seriously ill.
What kind of injuries are you talking about?
There's a variety of injuries. Probably the most common serious injuries are combined lower extremity injuries, combined meaning bone injuries, soft tissue injuries, vascular injuries to the lower extremities.
Are you seeing something that shrapnel type injuries?
Yeah.
Can you describe what?
So we're seeing a lot of shrapnel injuries. Many of those involve, again, predominantly the lower extremities, but shrapnel injuries can affect the entire body. So we're seeing.
Doctor, please describe the scene when people are coming in, when patients are coming in. Can you describe that?
Well, the first patient who came in was probably the most severe. We had 3 of the most critically ill patients come in about the first 15 minutes. At that point, we didn't know if that did turn out to be the tip of the iceberg, if that was going to be the tip of a huge iceberg or not. And so, I think actually everybody were prepared for that type of situation. So the hospital activated its incident command system, and within about 5 to 10 minutes, we had everything pretty much up and running.
What are the ages of the victims?
I don't have that information precisely.
Have you performed any amputations?
Yes, we have performed several
amputations.
I can't tell you the total.
Doctor, if you tell us how many patients you personally have treated, and I think we're all interested to hear, have any of them been able to communicate with you what they saw, what they witnessed, what they went through? Have they been in a condition to be able to speak?
So a number of patients have been able to talk. Most of them, we've kept it business only, to be honest. So in terms of just what affects their clinical condition precisely. You probably know more than I do about what happened at the scene at this point. You had another question, I'm sorry.
In terms of how many you've been able to treat?
Well, the hospital has treated 29. I have operated on 6 so far today.
How many are still in? 5 patients were unidentified earlier. Have you identified all the patients?
I don't know if we've identified everyone. I know that some of the patients who came in identified have now been identified.
How many remain in the hospital?
I don't know.
There have been a lot of questions about family members trying to reach their loved ones, any difficulty they may be having. Have you had any indication from the patients that you've seen if they've been able to reach their loved ones, their family members, if they've been able to find them at Mass General at least?
Some of them we have, some of them we haven't. Some who initially were unidentified, it took at least a couple hours. I know some of the patients that I personally treated, it took a couple of hours to find family. I don't know of the 29 total, or particularly the 11 who are in 8 who are in critical condition, if we've been able to reach everyone.
Were these runners or spectators?
Again, I'm not sure. I have not taken care of any runners. But of the 29 people, there certainly may have been some.
Can you talk about the shrapnel again? Did you see? Was it anything unusual or anything in particular?
So no, there's a lot of small metal debris. Some people have asked already about whether these were BBs or they were parts of bombs, and I just don't think we're able to say whether these are small bits of metal that were placed there intentionally or whether they were just part of the environment that were involved in the blast.
Do you think the people who are in critical condition at this point, things looking okay for them, or do you think?
Well, they're not looking okay because that's not what critical condition means, unfortunately. So, it's really too early to say how everybody is going to do.
How long will it take you? How long will this process continue with the 8 critical? Are we talking about hours, or is it?
A number of patients will require repeat operations tomorrow and serial operations over the next couple of days. So as I mentioned, a lot of the injuries are combined. They're combined bony and soft tissue and vascular injuries, and they have to be approached oftentimes in kind of a stepwise fashion.
How about eardrums? Were you seeing any shattered eardrums? Were these people in very close proximity to the explosion?
Yeah, so we have seen at least one, which is not uncommon with blast injury. One of the things on the to-do list for tonight, for me and the residents, is actually to go right back around. It can be hard sometimes, particularly if people are being rushed to the operating room to get a good exam, and repeat all of those exams, because that's obviously something you don't want to miss.
More information, on ages, hometowns, where these people...
No, I'm sorry, I can't actually. I just don't have that information. The hospital may be able to give it at a later date.
Can you talk about the amputees again? How many here at the hospital?
I can't tell you precisely right now. I mean, several.
All legs are on.
All 29 still at the hospital now?
I don't know that.
And can you give us an age range? I mean, were there...
There were no pediatric patients, so here we define that as somebody under 18. So that's that's actually all I can tell you. The oldest patient that I took care of personally is 71. I think that's the oldest patient.
What was the most horrific case personally? What was the most difficult for you? I mean, you're a surgeon, but still.
Yeah, I mean, it's just depressing that, we take care of accidents all the time. It's just depressing that it's intentional.
Have you ever seen anything like this?
The injuries are not otherworldly, but no, I can't say I've ever seen this volume of patients come this quickly with this type of injury.
Can you elaborate on what you mean by not otherworldly? Some of the initial reports we've heard are that it appears that these devices may have been IED-like or crude in nature, but you say the injury is not otherworldly. What do you mean? Can you explain?
Well, any traumatic amputation is it's a gruesome injury, but it's something that we do see from time to time in the course of daily life, even outside of this type of event. But
tough on you. I know you're trained for it, but did you think much about really what was happening, or does it kick in automatically?
No, I mean, this is work. So when this happens, we just go to work.
Doctor, you talked about injuries on a broad scale, but the 8 in critical condition, can you elaborate on their injuries?
Yeah, I'm hesitant to give you a kind of rundown of each of the 8, one by one. Again, the dominant injury have been combined complex lower extremity injuries involving blood vessels, bone, and soft tissue.
Your colleagues have combat medical experience, and if so, have any of them made any comparisons with this?
One of my partners actually has been deployed to Iraq and Afghanistan, and I think has probably the most personal experience with these types of injuries. He's been here most of the night. But I haven't talked to him directly about how does this compare to what you've seen in the field.
What about some of the patients' mental? You said you were keeping it business for the most part, and they haven't said a lot. Did any of them say anything that gave you some sense of what this experience was like for them?
No. I mean, people they want help in this kind of situation, and my experience today is not unlike I guess other similar circumstances. I mean, they're pretty brave. It's a terrible thing, and most patients' attitude is just do what you have to do and try to make me better.
So, Doctor, can you conscious or some
some conscious, some unconscious.
Doctor, can you describe, if you look over here a little bit, describe a little bit about the scene in the ER when it first happened?
We just got a series of patients on stretchers. Actually, none of them with the first wave, even some that were very seriously injured. None of the first few had breathing tubes in, so they were able to talk, even if they were in and out a little bit. Again, when it kicked off, the most severe injuries were really these lower extremity injuries. And so we had, I think, 3 in about the first 5 or 10 minutes, and that's when it became clear to us that it was going to be a busy day.
Had you ever seen anything like this before?
Again, like I said, the injuries individually are not completely outside the pale, but I've never seen this one come this quickly. I'm not sure how they were classified or when. I think certainly there's some patients who may not have been classified correctly the moment they hit the door. The other side did the case.
Disastrous first responders. How did that help today?
I was not trained by Israeli disaster first responders.
Doctor, given the horror that you've seen, we also heard the governor of Patrick say that he's seen incredible signs of hope and of help across this region, and we've heard reports of people saying that even runners have called the hospital, offered to donate blood as soon as they could, that's being coordinated. Have you seen any of those bright signs in all of this horror?
Well, I mean, what I can say is within the hospital, certainly, everybody rose to the occasion. I mean, we've had people who were out of town who flew back in here and somehow made it back in within hours, from nursing staff to ancillary staff to operating room staff to specialists in really all of the different disciplines. We've had, as much or more manpower or people power than we could use. I can't speak to the larger scenario, although I was asked by the hospital to mention to anyone who was willing to donate blood specifically that it's appreciated, that right now if they cannot forget that sense